looking after mycoplasma prior to this. The mycoplasma is also immunosuppressive disease. And in 1996, Dr. J.L. Wegar and me, we went to Nepal for a lecture. And during that period, he delivered a lecture that how we can correct pathological disorders with nutrition. And with that, the story started, and I started doing research way back in 1996 itself. I selected some of the molecules, and the results were very encouraging in the beginning. That product was named as a Protoase later on, and basically that period we decided that we will be confining to only immunomodulation, and with that, how we can see the success can achieve. When we were doing protophase trials and all that, then we came across that when we challenged the bird with the ND virus and IBD virus, there was no effect on that. There was morbidity, whereas in control group, there was 75% survival and 80% survival. So that was, and with that, we decided that only immunomodulators and immunotherapy will be our target for future. All over the period, whatever we are following, it is being delivered by Western culture. Western companies, they offered some product, they came with the data. No doubt initially it was required when there was no AMR problem and everything. But that time disease was also very less. If I can share with you, when I started the career, only we used to give Marex and ND vaccine. And today we are having over 15, 16 vaccinations. So immunomodulation, what it has been proved with the Intermune and Protoase, we have received much better titers. Almost 50% extra titer we get when we are supporting our immunization program with these two products. Immediately after the vaccination, you give this and you will be finding 50%. And there will be least risk of failure of vaccine. Normally, farmers, they blame vaccine has failed because it was not good. No, there can be other way also. Whenever there is a immunization is going on, liver is stressed, certain enzymes will be stopped and acute phase protein won't be available. Protophase and Intermune, they give such a quality of acute phase protein. You will be surprised to note that with Protophase, we don't allow even FMD disease to come.
FMD disease?
And yes, BIF people, they are using it since 2007. They had one first problem in 2007. Since that time, they never had, and they support their vaccination program of MD with Protophase. Our product is basically designed for male birds, for libido, sperm motility, and better hatchability. Whereas Intermune is overall immunomodulator, and once you are even periodically using, say, 3 days in a month, there is least risk of any disease at the moment.
Vaccines, can we say?
Yes. We are through with the products. In millions of birds under my supervision, I am keeping without any vaccination, any antibiotic. In my research, if we are using vaccines, straightway the bacterial load increased by 100.
Okay.
So, how it is possible? It means once we are doing vaccination, there is a stress in the bird, immediately microbes, they multiply and disease emerged. Moreover, why we are getting this problem of HPI, LPI, ND and all that? Basically, we are manipulating with feed ingredients. Toxicity is a major problem in present bird because they are very sensitive towards the gut health. And if there is a toxicity on the door, ND is always knocking. And the moment ND we find, we give Lasota. And Lasota is having a structural identity with LPI. But once you are using Intermune, do you find? No. So that is it. In fact, for coccidiosis, very recently we have introduced Raspafeed. We have another product, Multimmune also, which is we have observed very effective on this. But IBH, Inclusion Body Hepatitis, we researched this, we did research on this way back in 2005 itself. If we are using immunomodulator from our company, if ALT, ACTs, all these enzymes are controlled, then how IBH can come? And R&D, our product, one product takes almost 5 to 11 years to develop.
Okay.
First, I formulate, I try it on selected forms, then what are the outcome, different doses was given, and then. But recently, some of the institutions, they have started doing that. Like, for example, we have come out with a Raspafeed, a product. So, for that, we are doing trial at PDP,
Okay.
Hyderabad. Although it is a very extensive trial. For other broiler health and all that, we did it in IPMT.
Okay.
So, Redimune, it took 11 years to make.
IPMT Pune. Okay.
Redimune took 11 years to make. With single product, I give guarantee, if you are using, and whatever parameter is been given by the company for standards they have specified, if you don't get much more than that, standards minded is been made under the supervision of technocrats, qualified technocrats who are having experience of minimum 20 years and maximum maybe 55 years or 60 years, like our Dr. GL Jain. So, in getting same data or better than that in field, that is R&D required. Basically, I am tried my product in Kuwait, Bangladesh, Nepal, still I am giving, but mainly I am concentrating to my country.
Okay.
I want to give respect to my poultry in international market rather than selling them the product and they will be coming here and claiming that we are not using this.
Okay.
That way you can say I am a nationalist. Success, I can say I keep a very keen watch on anybody who is using smaller or the bigger. And normally, whatever data is being collected, minutely it is going to be seen by me. I keep track of that. And after compiling those data, then it gives us a strength that yes, we can claim this. If some product development required at that stage, we do add immediately.
Okay.
And we correct that. Like I can share with you, metapneumovirus when it came in India, people were very afraid of that. We immediately enhanced the immunity in some of the ingredients in Intermune, so that it should be more stronger in the market to check that metapneumovirus also. Then there is a Galibacterium annatis. Most of the people, they don't know, even consultants don't know. That is a resistant bacteria. Quite often, people are giving one antibiotic. After 48 hours, they find there is again but the mortality increase. Then they go for another, then they go for another, and finally they go for even injections also. But they don't find the result because it is resistant. It is resistant, but in our process, it totally we eliminate that.
Okay.
Because we don't allow ion bonding. So once ion bonding can't be given taken by that, so that is
okay.
Which we are protein molecules which we blend. There is no regulatory. We know if we increase this molecule, this much immunity will be going to increase further.
Okay.
So we increase that without charging from farmers extra, because we were more concerned that birds should survive. So it is these molecules, the blending of those molecules is our expertise.
Okay.
Very nice question. In terms of next 5 years, I can say, as I told in 2000, that in 2025, HPI will be a very great headache for everyone. In coming year, next 5 years, they have to drastically reduce their production cost. If they don't reduce their production cost, then now getting, company says 188 hatching egg you will get, but people are getting 150, 160. Company says hen house production will be 330. People are not getting even 300. Then broiler, FCR company, number of company they make feed so that FCR should not reduce less than 1.5, otherwise they have to give incentive. Moreover, how much conversion you are getting? FCR 1.2, 1.25 is required for 2 kg. But what percentage of meat you are getting? In 5 years, if you don't go with that, then again, because people are not ready to eat with the bone, you require boneless, and we do give in writing 5% extra boneless is guaranteed with our product. If anybody has to survive, they have to come on immunotherapy. May it be from my company's product, may it be from anybody's company, but without antibiotic you have to give. AMR is very big problem world over. At the same time, cost effectiveness is required, and conversion. In our researches, our breast portion is almost 100 to 150 gram extra per bird. Just imagine, 150 gram will be how much in terms of
industry?
They are fantastic in hard work. Only thing is this, they have to organize themselves, and at the same time they should think of earning foreign exchange, because shortly there will be foreign exchange will be available to those industries only who are earning for the country. So they must think of quality, not quantity. They must think of entering to international market. They writing or stamping antibiotic-free is something else. Don't think international brands or international multinational companies are fools. They have collected each and every product from the market. They have complete data with them. That is why I am telling disease control AMR, and we do, when we are giving to this industry a guarantee that no listeria will be there, no salmonella will be there, no enterobacter will be there, no aerobic plates will be there, no heavy metals will be there. In spite of that, if they don't try to enter international market, and we do give collect egg from our regular users who are on immunotherapy, that whether they are following our instruction, their egg is safe. So we get them tested in FICI laboratory, which is Government of India undertaking. We don't go here and there. And from there we periodically collect. But there are breeders also. So one more message I want to give: if India's top corporate house is endorsing our product, why not you?